This presentation is on the mental health crisis in the juvenile delinquency system. There is growing attention on the high percentage of mental health issues in the juvenile justice system. A young person with mental health wellness is in an adjusted state of well-being, psychologically, physically, socially, economically, and within their environment. Youth with poor mental health will show irritableness, use aggressive words or actions, and withdraw from society. They will seem anxious and suffer depression. They could eventually abuse alcohol and drugs. The issue in the juvenile justice system is that many facilities do not adequately screen for mental health issues. There are much higher rates of mental health problems in juvenile delinquents relative to the general population. These subgroups presented here of mental health issues will suffer far more serious and critical mental health disorders that will increase their risk of committing violent offenses, returning to the system, and having a 13% increase in drug abuse. Many psychiatric professionals do not work in the juvenile justice system and instead train the staff at the detention centers. Affective disorder, mood disorder, will present in juveniles with anxiety, paranoia, aggression, and possible bipolar symptoms. Psychotic disorders are PTSD, schizophrenia, and suicidal thoughts. Anxiety disorder is panic disorders or phobias. Disruptive disorder, the most common misdiagnosis of juvenile delinquents, is an umbrella of all of these. Only 40% in 2002 were diagnosed with one system, typically ADHD. Many local jurisdictions use self-reporting. However, most youth entering the system perform educationally several years below their peers and cannot fully comprehend self-reporting. Today, 80% of incarcerated juveniles have mental health issues. 2/3 are incorrectly diagnosed for only one disorder. 10% are reported with a psychotic disorder, when actual reports show that 30% in facilities have a psychotic disorder. Greater emphasis must be placed on correctly addressing the mental health needs of juveniles within 24 hours of intake. Some of these youth are born with neuropsychological deficits or congenital disabilities from being exposed to heavy fetal alcohol and/or severe mistreatment. Antisocial disorder can manifest into several mental health issues. Learning disabilities associated with mental health can create frustrating circumstances for these juveniles. Poverty and further abuse and neglect can only isolate and enhance depression, anxiety, and disorders. They will detach from family, school, and peers, creating weak social bonds. The social bonding theory supports that if elements of the social bond are weak, individuals will deviate and show poor choices. The continuous misdiagnosis of juveniles with mental health issues and lack of productive treatment can create repeat offenders. Youth with mental health issues are at a higher risk of recidivism. They abuse drugs. Data shows juveniles as young as 13 have early onset antisocial behavior, and 85% of those get involved with substance abuse. Physical aggression, disobedient, impulsiveness, and anger result in higher risk of drug abuse and crime. Detention of the most serious offenses occur when frequent substance abuse is combined with mental health issues. The impact to society is not only the loss of safety, but the loss of possibly productive young members. A research program in New York shows that youth with a history of substance abuse brought on by their mental health issues ended up 1.5 times more likely to be involved in arson, burglary, murder, rape, and kidnapping. These crimes lead to adult confinement and no mental help. African American and Hispanic males account for a large percentage of the youth in system. Although smaller in numbers, females have greater risk, higher percentages, and higher service needs for mental health issues. 2/3 of the male population surveyed met standards for psychiatric disorders. 3/4 of the female population overwhelmingly met these standards. Females have higher rates of maltreatment, abusive childhood experiences, and being victimized. Programs should be designed to specifically focus on the victimization of young women. Caucasian male and females had higher percentages of mental health needs at 83.3% compared to the 70% of the Hispanic community and the 63.3% of the African American youth community. Hispanics were higher in substance abuse and ADHD. African American juveniles showed higher percentages in conduct disorders, while Caucasian males detained were higher in psychotic disorder and antisocial disorders. Intake procedures that don't provide a clear scale of mental health issues are all too often used to screen and assess juveniles in the system. They only look at their history, their school performance, their family and their peers, and previous records. The consultation of mental health professionals are rarely sought. MRI or experimental assessments are not allowed as evidence. Currently, Ohio's juvenile justice system uses a system called Ohio Scales that measures through immediate evaluation the severity and functioning of a mental health issue. This is a great method to look at. The APA did an evaluation of numerous juvenile justice facilities, their intake measures for mental health. Over 50% failed. Less than 30% did a 7-day follow-up. A small 4% had on-staff services for severe cases. A new trauma system checklist must be put into place. That checklist should be done within 24 hours of intake. It should be done by a licensed psychiatric professional. For example, a juvenile facility in Cook County recently hired a clinical psychologist to be the warden. We must accept that the juvenile justice system is becoming a mental health business. Restorative justice, so that the victim, society, and the delinquent can be given therapy, and programs that assist in making amends and reducing recidivism should be forefront. 80% is a crisis at hand, and the system is in need of new forms of therapy that have been researched and tested to be productive, like functional family therapy, trauma-focused therapy, and multisystemic therapy. Early intervention needs to happen when antisocial tendencies present. Clinical levels of brain damage can be addressed in early intervention programs as well that focus on problems with learning, verbal ability, literacy, and hyperactivity. Differential reinforcement is the balance of rewards and punishment. If a youth in detention receives rewards for good behavior, then that behavior is sought after more so by that individual. The juvenile justice system is facing a mental health crisis. There is no thorough screening and diagnosis process. The overall goal of the juvenile justice system should be to provide every youth with an educational plan, continue to evaluate and review the mental health of each individual, assist them in possessing skills while confined, enhance job placement, and continue to educate the community on these issues so they can successfully reintegrate back in. These 6 elements, student plan, ongoing reviews, job placement, and community integration have been essential elements of any mental health plan.